Welcome to our third policy briefing, I guess you'd call it, for the campaign to end unwanted medical treatment. And I extend this welcome from the campaign and its collaborating organizations, so there are quite a few of those. My name is Larry Atkins. I'm the president of the National Academy of Social Insurance, one of the collaborating organizations. And I'm happy to be here today as the moderator for this discussion, which just means I get to talk to you first, and then I'm going to sit down and listen. But just to start with, the objective of the campaign is pretty simple. It's really to ensure that all patients, have dignity in honoring their wishes, goals, values, and preferences. The campaign is dedicated to ensuring patients and consumers receive the medical care they want, nothing more and nothing less. There we go. So we have a growing group of collaborators on the campaign. We're now up to about 19 national partners supporting the campaign. We have 3 new ones: the Altarum Institute Center for Elder Care and Advanced Illness, the Catholics in Alliance for the Common Good, and the Women's Institute for Secure Retirement. So we're pleased to have these groups join the effort. And also I'd like to take a moment to thank the Consumer Coalition for Quality Health Care, the Elder Justice Coalition, and Compassion and Choices for their financial support for these lunches. So, we started out in December. We heard from Dr. Bud Hammes, the Director of Medical Humanities at Gunderson Health System in La Crosse, Wisconsin. Dr. Hammes has designed and implemented a very innovative and highly successful advanced care planning model known as Respecting Choices that places the person at the center of the decision-making. And then in March, we had our second luncheon with Dr. Bruce Vladeck, that I know a lot of people know or know of, the former administrator of the Healthcare Financing Administration, which is now CMS. And he has been spearheading what is now a 3-year effort funded by the SCAN Foundation known as Dignity-Driven Decision-Making. So he talked to us about that. A brief that was prepared by Dr. Vladeck and Aaron Westfall from the SCAN Foundation that was that appeared in Health Affairs in 2012 kind of characterized dignity-driven decision-making as a process that builds on previous efforts to define and develop patient and family-centered care for those with advanced illness, more a framework than a rigid structure. The dignity-driven decision-making model emphasizes the centrality of a collaborative process in which patients, their families, and clinicians work together continuously to define the goals of care and how best to implement them. So, we've had the opportunity to hear from and gain a great deal of insight from, 2 leaders in this field, and really about models out there that are up and running and working and interesting. So today, we're very pleased to have a different perspective on these issues. And this is a perspective that really comes from the public policy and the political space around these questions. And as you know, these are issues that have in the past resonated fairly substantially in the political world. And so I'm sure we'll have a chance to hear more about that today. So I'm really pleased to welcome Chris Daw, who is a person who's made substantial contributions to the development of federal health policy, both serving in the administration and on the Hill. Until last week, actually we're intruding upon his post-work downtime. But until last week, he was the healthcare advisor to the National Economic Council at the White House. And in that role, he advised the National Economic Council leadership on a wide range of healthcare issues, especially related to delivery system reforms and issues affecting key populations, including those with advanced illness. Before that, he was the director of delivery system reform at HHS in their Office of Health Reform, where he supported the implementation of the elements of the Affordable Care Act that seek to foster the delivery of higher quality, more affordable health care. And before joining the administration, and actually during the passage of the Affordable Care Act, he was serving as a professional staff member on the Senate Finance Committee for its then chairman, now ambassador to China, Max Baucus of Montana. And there he covered all issues related to Medicare Part A, which anyone who's ever worked in Medicare Part A knows are voluminous. So we're delighted to have Chris here today to share his insights on the various options and approaches to developing high-quality and cost-effective models of care for those with advanced illness, as well as discussing some of the key administration initiatives, such as the recent announcement of the next phase of the Hospice Concurrent Care Demonstration Project, and then hopefully share some indiscretions about, really what goes on in the White House. So we're very interested. So with that, I'm pleased to turn it over to Chris.
Thanks, Larry. And thanks to Brian Limburg, if he's still here. I think he's going to sneak out in the middle of my remarks, but thanks for inviting me. It is, there you're on the spot. You can tell him where you're going. It's great to be here. As Larry mentioned, this is my first week outside of public service for a number of years. And I couldn't think of an issue more important to me and to the cause to come and speak to you guys about.